Good morning, everybody. I'm Gary Pace, the Public Health Officer for Lake County, and we are going to give a coronavirus update this morning. Mainly, there's no Board of Supervisors meeting this week because of the holiday, and so we thought it would be a good idea to go ahead and just give the information this morning and put it out over the Facebook and PEG TV. So thank you for your attention. It's Monday, Labor Day, September 7th, 2020. And so where we're at now in Lake County is we've had continued positives coming through over the weekend. We have a total of 368 positive cases at this point. 2 are in the hospital. Total of 5 people have passed away that have been COVID related. And the big thing that's happened is there's been an outbreak in one of the skilled nursing facilities. So at this point, there are 6 staff members positive and 15 residents that are positive. 2 additional residents have passed away that were positive for COVID at the time of their death. The nursing facility has taken the proper steps. They're following the protocols. They're working with consultation from us and also from the state about how to manage this, and they seem to be taking all the proper steps. But this is a very concerning situation and has been very problematic in other places around the state when this has happened. A lot of precautions were taken to try to prevent the virus from getting into the facilities, and there are three total nursing facilities in the county, and so far, these prevention methods seem to be helping in the other places. So, but it is a significant development for us. And what we're seeing is that the cases are continuing to spread, but at a kind of slow to moderate rate. There is a fair amount of activity in different businesses, and anytime the people are coming together, whether it's the kids in the schools or in the businesses, there seems to be some spread. And so we're trying to work with the businesses and with folks at the schools and other places to try to take proper steps when they do get a positive case, inform other staff, inform the public, take the proper disinfection measures at the facility. But one of the real important things to again emphasize is that we are seeing when employees or when the public or are all wearing masks, it's pretty rare that the virus is transmitted when we do see a positive case. When we're seeing these outbreaks, it's usually there's some problem with masking. Either people are getting careless or they don't believe in it or something like that. So again, just to emphasize the real importance of the masking. We're a little bit concerned now because of Labor Day. The other place that we are seeing a lot of spread is social gatherings, whether it's parties or weddings or funerals, all those sorts of things. And with Labor Day weekend being here, it's a pretty tempting time for people to get together. So again, we want to just encourage everyone to take extra precaution during this weekend because we really don't want to see a big surge in cases in a couple weeks. To give a little context, in Sonoma County, where we have seen a really high level of transmission recently, things are starting to get under control a little bit. The curve is starting to flatten. The number of new cases is decreasing. They do have an outbreak in one of the local hospitals, which is concerning. At Santa Rosa Memorial, they have, I think the last I heard was 17 staff that had tested positive. I'm not aware of any patients that have contracted it there, but that is it is a concerning thing. And then also several of the nursing facilities have significant outbreaks there, and over half of the deaths they've had in the county have been at the nursing facilities. In California, overall, the number of cases is going down. The death rate continues to be fairly high, kind of statistically. There's over 100 deaths per day in California still that are related to COVID, but we do seem to be seeing some decreasing of the new cases and of hospitalizations. Currently in Lake County, the testing positivity rate is 5.4%, which is, so what we usually see is the first thing that goes up is the testing positivity rate. Concerning level is 8.0 or higher. we're at 5.4, which is pretty much where we've been for a month or two now. But when you do see a rise in that, often there's 2 weeks later, there's a rise in cases. And then 2 weeks after that, there's a rise in hospitalizations and then eventually deaths. So we're watching that closely. So in terms of the response in Lake County to the COVID outbreak now, the data piece is the state data the problems with the state data appears to have been resolved now. So we are, the data seems to be pretty good. We have a little bit of a discrepancy between our calculations and the state calculations in terms of the new tiered system when they're doing that, but we're continuing to try to engage with them in conversation and sort some of those things out. Our portal site is going to be shifting a little bit over the next couple of weeks as we try to really just align it with what the state's doing. They've made some shifts in what they're reporting and what they're following, and we're trying to reflect that on our data portal. But so you'll just have to stay tuned for that. The testing sites are continuing along. Verily is closed today on Labor Day, but they should be back open tomorrow. And the current contract is through September, so we should see the testing sites still be available through September. And then the state is actively working on a long-term contract with some of these stand-up test sites around the state. So I'm fairly optimistic that we're going to be able to continue something, although it may be a little bit different than the current setup. The demand for testing has been down the last couple of weeks, so we've seen fewer people wanting to get tested. I just want to encourage people that if you have symptoms or if you feel like you may have had contact with somebody who's positive, to definitely go and get tested. The turnaround time has improved a lot now, so we're really getting results in 2 to 3 days most of the time now, whereas it was a couple weeks a little while ago. So they have made some real progress in resolving some of those problems. There's also really, there's been a little bit of conflicting information coming out from the CDC and from other places, but I just want to emphasize that from the state public health point of view, and certainly from our point of view locally, more testing is better. We want to encourage people to get tested if they have any interest in it. That's really how we're going to find the cases and really be able to control things here. So if you're coming across obstacles and you do want to get tested and you're not having any luck figuring out how to do that, please let us know. And we can help you do that. So you can contact us at the health department for that. We're also working with the schools some about trying to set up some testing capacity for the teachers and the staff, which is as they open up and have the kids doing on-site learning, there's a real interest in getting the teachers and the staff tested regularly, so that try to help prevent spread there. In terms of the contact tracing, we are able to keep up at this point. People are getting contacted usually within a day to figure out what's going on and find out who they've been in contact with. So that's been very good in our county. Other places, because of the higher numbers, are having trouble doing that. But so far, so good. And we're getting some help with some of the state contact tracers to do that. The housing issues are, we do continue to have some hotels that we put people up that need to isolate or quarantine and they don't have a good living situation to do that in. So if that situation comes up for you or somebody else that you know that you are being told that you need to quarantine and you just don't have the ability to do that where you live, let us know and we have a program to take care of that. There's also this homeless services now are being provided over at Juvenile Hall. There's probably between 20 and 30 people that are being housed over there in this COVID environment. And we're very fortunate that the Elijah House has gotten involved with the county and is working over there to provide services and keep people safe. So very, very appreciative of that. Now, the hospital situation has been good. We have 2 people in the hospital right now, but overall, we've been able to manage reasonably well. St. Helena is back open again, so that's helped with the Adventist transfers out. So we'll just keep monitoring this whole situation at this point. And in terms of the fires and the evacuations, from the fires last week, all the evacuations have been lifted now, and it felt like this was a very successful collaboration in terms of setting up the evacuation, and the attempt with the sheriff was doing all that, of course, and OES, but the people that were needing to be evacuated and had to get sheltered in the county were basically being screened so that we could keep anybody who had COVID out of the congregate shelter, and anybody who was particularly at risk of being in a congregate shelter because of the concerns about possible spread of COVID in the shelter. We were able to keep all those folks separated out of the congregate situation and also from each other. Luckily, the numbers were low of people that needed sheltering, but we were able to work through our system and to kind of strengthen the collaborative ties with social services and Red Cross and animal control and the sheriffs. And so it all seemed to go pretty well. And we'll see now with this new red flag warning coming in tonight and the heat problems and potential fires, it's really, this is a definite time of caution. And, but, we have been planning, and we're confident that we can really address things as they come. So I think the long-term questions are the last kind of section that I like to talk about here. And so one thing is the flu season's coming up. And, I think there's a lot of the experts are sort of predicting that this may be a really difficult fall and winter. If there is a spike in the flu, this fall, it could be very stressful on the hospitals, and to have COVID in addition to that, it could be problematic. So I really want to encourage people to think about getting their flu shots and moving forward with getting flu vaccines so that you can at least be protected against that part of things. We're trying to get more testing capacity in so that we can discriminate between flu and COVID so that we know what we're dealing with as it's coming. There's predictions of this surge in COVID as well as people move more inside, schools are opening, things are happening like that. There's most of the modeling now shows that the number of deaths, which is approximately 185,000 in the U.S. at this point that are COVID related, may double by the end of the year. And of course, this is modeling, so we don't know for sure. And if people are able to take more precautions, we'll probably be better off. But that's kind of the way it's looking right now because of the level of infection that's around and where it's going. The big question always is a vaccine. Are we going to be able to get a vaccine? The president is suggesting that maybe something's going to happen by the end of October, early November. Most of the clinical experts don't seem to feel like that's real likely, but there may be something by early 2021. And but then we're still going to have the issues of who gets it, how to disseminate it, how to get it out there. And so most likely it'll be by next summer before we get widespread use of the vaccine. We are so the state matrix with 4 tiers that came out about a week ago is now sort of getting in full swing, and we are on the red tier, which is the second most restrictive tier. And before there's going to be any changes, you have to have at least 2 weeks of consistent data that shows the next level, whether it's up or down, before you can switch. So basically what the state's going to come out on Tuesday mornings with their new calculations. And it's not clear whether we're actually going to get any warning beforehand or not. So at this point, I don't know exactly what the state's calculations are. We will find out tomorrow morning. We won't have a change either way after tomorrow's data. So we would need at least 2 weeks in a row of consistent data to make any changes. But so I don't see any drastic changes happening tomorrow, but it'll be very, very interested to see where their data is. Our data has us in a slightly higher case rate, but partly because of this nursing facility outbreak and partly just because of the general spread around the community. But we'll see where exactly that lands us. The schools are continuing along. There's the 2 school districts that are having on-site learning, and the rest of them are all open, but they're having predominantly remote learning or with some special situations with people on campus. So there's a really, I think the last piece is just businesses and business viability in this time. We're really encouraging businesses to do what they can to be open, given the guidelines and the restrictions that are there. And so something happened to my video feed here.
You're fine.
Did I lose you, Sam?
You're fine on this end.
Oh, okay. Sorry. Something just jumped out. But basically, we are really interested in talking with businesses about anything that can be done to help them continue moving forward. I've been talking some with the Chamber of Commerce and the Rotary clubs and things like that. We're very there's some groups starting, or there are groups that have formed and are starting to form to try to think about how to move forward for the next 6 to 12 months if this situation continues. I think realistically, from the public health point of view, that we are going to be moving up and down these tiers that the state has set up based on our case counts and based on the positivity of tests in the community. And so as the case counts go up and the positivity rate goes up, we'll probably need to move down the tiers to a more restrictive level. And as things get under better control and move forward at a better rate, we'll be able to move up the tiers and there will be less restrictions. And really the way it's currently set up with the state, and I'm sure this will be evolving, but the more restrictive has less available capacity indoors, because that seems to be where most of the spread is. As the restrictions are lifted, more indoor activity is allowed in restaurants and in movie theaters and in places like that. So I think businesses really needing to think about this and figure out creative ways to move forward in this environment where virus spread is going to be an ongoing concern for officials, but also for the public as well. So I guess really I just want to thank everybody for all the work they're doing to try to keep this whole thing moving forward. I know this is very disruptive to people's lives, and kids being out of school and people being out of work is just very, very challenging. And we've done quite well in Lake County over the last 6 months, and I hope we can continue moving forward together in a collaborative way to try to keep everybody safe and keep the businesses open and keep some economic activity going. So thank you very much.